Welcome to Dementia-Friendly Prince George's County, Maryland Northern Sector webinar series for caregivers. Today's topic is Medicare Supplement versus Medicare Advantage by Patricia Dorn, sponsored by Prince George's County Government and the Department of Family Services.
Hi, everyone. My name is Patty Dorn. I'm with the Maryland Insurance Administration. I'm going to talk to you today about the Medicare Supplement Advantage in Maryland. And if you have questions, you can just go ahead and ask them in real time, and I'll try to take them in real time. I'm assuming we're using the chat. So Dominique, are you going to monitor the chat?
Yeah, I will. When I see questions, I'll let you know.
Perfect. Okay. All right. I'm just going to do the slideshow from the beginning. So Medicare Supplement and Medicare Advantage in Maryland. I need to tell you that this presentation does not provide legal advice and that you should discuss specific questions with your trusted financial advisor or insurance producer. The agency that I work for is the Maryland Insurance Administration. We are the state agency that regulates the business of insurance in Maryland. And what that means is we're the entity that we license the insurance companies to operate in Maryland, and we license the insurance producers. So we give the license to the agents and the brokers to sell insurance products in Maryland. We make sure that the business practices that these insurance companies follow and these agents and brokers follow, we ensure compliance. So that means that we make sure that they follow Maryland laws and applicable federal laws. We monitor the solvency of insurers, and that means we make sure that they have the money to pay your claims in the future. A lot of consumers, I think, try to take it on themselves to sort of, figure out whether or not an insurance company is solvent, essentially has enough money to pay claims. And I mean, really, if you're not an accountant and you're not an expert in finance, that's a pretty difficult thing for you to do. And so I think a lot of times consumers just do that by saying, well, this company has the money to put on commercials or billboards, etc. So they must have the money to pay my claims. If an insurance entity is licensed by the Maryland Insurance Administration, they all have to follow the same rules. And so if you're purchasing from an insurance company that is licensed and regulated by us, I would not be worried about their solvency. Essentially, it is our job at the Maryland Insurance Administration to make sure that the insurance companies that operate in Maryland are solvent. We also review and approve the policies that are issued to you. We review the insurance rates to ensure that they are not inadequate, but that they're also not excessive or unfairly discriminatory. That is a little bit more complicated than this one sentence implies. There's different laws for different insurance products, be it today we're talking about the Medicare Supplement, et cetera, but be that health insurance, life insurance, auto insurance, homeowners insurance, et cetera. We have different levels of ability to set the rates based on the different products, based on the state laws. And then we investigate consumer and provider complaints and allegations of insurance fraud. So what that means for you essentially is if you have a problem with an insurance company in Maryland or the entity where you can file a complaint, and we will investigate it. At the bottom, there's a link to a video. I'm not going to show a video tonight, but we have all kinds of videos. We have a YouTube page and all kinds of videos about insurance. Most of them are only a couple minutes long. We're trying to kind of meet people where they are. Some of them are longer, if you're looking for more information, but if you do want information, you want to watch videos about different insurance products, I recommend our website, our YouTube page. So just some examples, filing a complaint with the Maryland Insurance Administration. If you have a claim in progress and it was denied and you disagree, you can file a complaint with us. If your insurance company is delaying payment from a claim, if you believe that your policy was improperly terminated, your insurance premiums were raised without proper notice, if you believe that an agent or a broker made false statements to you in connection with the sale of insurance or in the processing of an insurance claim, and if you believe that you are overcharged for services, you can contact us and you can certainly file a complaint. So that's just to put in perspective who we are and what we do and why I'm talking to you today about these products. I just want to make sure that we start with the basics. So I am going to do a little bit of a review of Medicare because I find that when I don't do the review of Medicare, sometimes a lot of times there's people in the audience who really do understand where the Medicare Supplement and Medicare Advantage kind of fall into that big picture of Medicare, but I want to make sure that everybody's kind of on the same page here. So Medicare itself is government-sponsored health insurance for 65 plus, older adults 65 plus, and younger adults with a disability. It was created in 1965 by Congress, and then it was expanded in 1972 to disabilities under 65, as well as those with end-stage renal disease. The Medicare Modernization Act of 2003 established Part D. So Part D has only been around since 2003. Who's eligible for Medicare? U.S. citizens 65 and older with sufficient quarters of work credit under Social Security. So that generally means 10 years. 40 quarters, you get 1 credit per quarter, 10 years. Adults under 65 with disabilities are eligible after they've received Social Security disability benefits for 24 months. On the 25th month, that's when they're eligible. They're also eligible with a diagnosis of ALS. In the first month, they receive SSDI benefits, and then eligible at any age with end-stage renal disease in the 4th month of dialysis. So Medicare Part A, that is hospital insurance or inpatient insurance. It's funded by payroll tax, FICA, and most people with a personal or spousal work history who've paid into Social Security do not pay for Part A. So for the most part, for most people, Part A is free because either they have 10 years, 40 quarters, or they were married to someone who does. However, not everyone meets that criteria, and some do pay a premium for Part A or a partial premium for Part A. For example, if they only had 20 credits and 5 years work, etc. So Part A covers your care in a hospital. It covers some of the costs of skilled nursing facilities and home health services, as well as hospice care for the terminally ill. Medicare Part B is referred to as outpatient insurance. Part A and B together are referred to as traditional Medicare or original Medicare. That's what's on that red, white, and blue card that Medicare beneficiaries receive. Again, in many cases, you have a start date for Part A, you have a start date for Part B right there on the card, and sometimes it's not the same date. A lot of people start Part A before they start Part B, but that red, white, and blue card, the Part A and B together are traditional Medicare and original Medicare. And the reason I'm pointing that out is because when we start to talk about the Medicare Advantage plans, that isn't traditional Medicare, that isn't original Medicare. With the Medicare Advantage plans, they've bundled it all together, A, B, D in most cases, and the additional supplemental costs are bundled together into one thing, and it's just not called traditional Medicare, original Medicare anymore. It's referred to as the Medicare Advantage plan. If you decide to purchase the Medicare Supplement, you do have traditional Medicare, you do have original Medicare. So Part B is funded by Part B premiums. So most people pay a Part B premium, not everyone. There's financial assistance for many people with regards to Part B. But that's what funds the program, as well as general revenues from the federal government. So that's just to say the premiums that are paid in by Medicare beneficiaries for Part B do not fund the entire Part B program. Part B covers doctor services, lab tests, medical equipment, ambulance services, prevention and wellness screenings, orthotics, prosthetics, and mental health services. There is a permanent penalty for late enrollment into Part B. It is 10% of the base premium for each year that you delayed enrollment. So not everyone needs to take Medicare Part B when they turn 65. If you are working and you have health insurance through work, you can, in most cases, you can delay taking Part B until you retire. But if you were in a situation where you turned 65 and you didn't have insurance through work, in that case, and in most situations, you would need to take Part B. If you delayed taking Part B, if you did not enroll in the Part B program for an entire year, they're going to penalize you 10% of the premium. And that 10% penalty lasts for your entire life. If, for example, you didn't enroll for 2 years, that would be a 20% penalty, and that 20% penalty would follow you for the rest of your life. So that's just an FYI about how that works. There's also a penalty if you don't enroll in Medicare Part D. D as in drugs. So this is where we're going to start talking a little bit about the Medicare Advantage plans and the Medicare Supplement plans. I'm starting with the Advantage here. I'm going to go back over to the supplement, and then I hope to, toward the end, share the Medicare website itself so you can kind of see some resources. So Medicare A and B, that covers about 80% of the costs of your inpatient and outpatient care. So A and B is covering about 80%, and you have to figure out a way to get that other 20% covered. Because it's not as simple as if I go to the doctor and it's $100 to see a provider. You know, maybe you might think it's no big deal. A and B is going to cover 80%, $80, and I'll cover the other 20. And that can be fine with little things. But, you know, if you experience something like a hospitalization, et cetera, situations where the hospital bills can go into the tens of thousands, hundreds of thousands of dollars, you definitely wouldn't want to be responsible for that 20% that A and B do not cover. So there's 4 real options for you. Some people qualify for financial assistance. They qualify for what's called the QIMBY or the SLIMBY program. And the QIMBY or the SLIMBY program can help out with those costs. And so people that are relatively low income can qualify for that. Some people receive insurance through their former employer, so through retiree benefits. So those who receive retiree benefits, that often covers the 20%. So they're covered. And then everyone else is sort of here deciding what makes sense for me. Do I want a Medicare Advantage plan? Do I want a Medicare Supplement plan? And what is the difference? Because it is confusing. So what is referred to as Part C in the Medicare program is Medicare Advantage. With the Medicare Advantage plans, they're offered by private companies under a contract with Medicare to provide Parts A and B coverage, and they may offer Part D. In most cases, the Medicare Advantage plans that are offered in Maryland do cover Part D. So you would choose a company and they would give you a card, and it would work a lot like insurance that you had through work, or potentially if you had Medicaid at some point. You're going to have this one card, and it's going to cover A, B, D as in drug, and some of the additional costs that A and B do not cover. With the Medicare Advantage plans, you are, in most cases, limited to a network. And that's a really important part. There's going to be a network of doctors, and those are the doctors that you can see without having to pay additional costs out of your pocket. So before choosing a Medicare Advantage plan, you need to make sure that those doctors that you want to see, if that is something, if you have doctors that are important to you to visit, you need to make sure that they are covered under your Medicare Advantage plan, that they are part of the network. They might offer additional benefits not covered by original Medicare, such as vision and dental services. So a lot of the Medicare Advantage plans do have a lot of bells and whistles. Those bells and whistles might include some coverage for vision. Maybe they give you $100 a year for an appointment to check your vision, or maybe they give you some money that you can spend on new glasses. They might cover dental services. I haven't looked closely at the plans in a while, but a lot of times they would cover $500 a year dental. They have gym memberships, etc. They do offer benefits that are not covered by original Medicare in many cases, which makes the plans, more popular. It makes people interested in the plans. The patient still pays the Part B premium. And so that's important, because I think that does confuse some people. In many cases, you're gonna have a premium for your Medicare Advantage plan, but you still are responsible for the Part B premium. That also gets kind of complicated sometimes, because sometimes there is no premium for the Medicare Advantage. Great, there's 0 premium plans out there. So in that case, you're not paying the premium for the plan itself, but you're still paying the Part B premium. Recently, in the past couple of years, it's even gotten more complicated because now those Medicare Advantage plans can offer to pay part of your Part B premium. So in some cases, they're paying part of your Part B premium. So just pay attention. They'll, look at the plans, and it should be pretty clear what you're going to have to pay, if you're still going to have to pay the Part B premium, etc. With the Medicare Advantage plans, you're going to see co-pays and deductibles that are similar to typical private health insurance. So anytime you see a doctor, anytime you sort of touch a doorknob, see one doctor and then go into the other room and receive some other service, there's probably going to be a copay associated with that. What that copay is going to vary greatly from company to company. And so these are things that you need to pay attention to. So maybe it's $50 to see your, it's probably something more like $25, to see your general provider, $50 to see a specialist, maybe $75 or $100 if you get some imaging done. The one thing that I really want you to pay attention to if you're looking at the Medicare Advantage plans is how much they're going to charge for the first days of hospitalization. Some of them, the most I've seen is $350 a day. And I think that's up to 9 days. So that's just really important. Make sure that you understand that, because any money that you're saving by going with the Medicare Advantage plans versus the Medicare Supplement, if you're purchasing a plan that's going to charge you $350 a day for hospitalizations, you may be very, very quickly erasing any benefits that you're receiving by signing up for the Advantage plans. Medicare open enrollment is October 15th to December 7th. Medicare open enrollment includes the Medicare Advantage plans. And that's why, as October's coming up and all the way through, you see a lot of commercials for the Medicare Advantage plans and for Medicare Part D plans. That's because that is open enrollment. The Medicare Supplement plans are not part of Medicare open enrollment, and we'll get into that more. But with these, you can sign up October 15th to December 7th, and you can change your Medicare Advantage plan every single year without underwriting. That means no one's going to ask you any health questions. You can go ahead and pick whatever plan you want, and you'll get the best price. So that is Part C. And now I am going to start to talk about the Medicare supplements. The next page is actually Part D. That usually works for most presentations, but for this one, it kind of breaks it up a little bit. So just real quick, Part D is the drug coverage. D is in drugs, medication coverage. With most of the Medicare Advantage plans, Part D is bundled in with it. If you decide a Medicare supplement is the way to go, you need to purchase your Part D separately. Just like the Medicare Advantage plans have the open enrollment from October 15th to December 7th, the Part D plans also have that same open enrollment. So if you do have a Part D plan, you can look at all the Part D plans every year, make sure that you're still in the best one, and you can switch. And they're not going to ask you any questions. You're going to get the best price possible every time. Also, just like Medicare Part B, there's a permanent penalty for late enrollment. So this is the federal government saying, if you don't have a drug plan, you turn 65, you need to sign up for Part D. If you do not sign up for Part D, then you will be penalized down the road when you do sign up, if you do sign up. All right, so the Medicare supplement. So Medicare Advantage plans. With the Medicare Advantage plans, a couple highlights. You're going to have a network. There's going to be a network of doctors that you need to see. Otherwise, you're going to be paying additional expenses out of your pocket. You're going to have co-pays. So, $25 here, $50 there. Services include co-pays with the Medicare Advantage plans. They have bells and whistles. They don't just supplement original Medicare. So they don't just kind of help you out with that 20%. They might offer you dental, vision, etc. And so those are some of the highlights for the Medicare Advantage. With the Medicare Supplement, the Medicare Supplement is a product to supplement original Medicare. So it doesn't bundle everything together. It's covering part of that 20% as a separate product. It pays for cost sharing for parts A and B, but not for D. So Part D, if you purchase the Medicare supplement, you do also purchase a Part D plan. It's purchased from private insurance companies. There are 12 standard plans in Maryland. There is a 6-month Medicare supplement open enrollment period where you can purchase any Medicare supplement plan sold in your state without underwriting. With the Medicare Advantage plans, you can purchase a different one every single year without underwriting. With the Medicare supplement plans, it's a little bit different. Your only full time to purchase without underwriting is the first 6 months after you start on Medicare Part B. There is a new open enrollment period called the birthday rule, which gives you some flexibility around the date of your birthday to switch plans, also without underwriting. And I won't get into that too much in this presentation, but feel free to ask questions about it if you're curious about the Medicare Supplement birthday rule, because it does give you some opportunities to switch without underwriting every year, but it's not the same open enrollment period as the Medicare Advantage and the Part D plans have. What else do I want to say about this? All right, I'm going to go to the next slide. Is a Medicare supplement plan the same as a Medigap plan? That's the same thing. At the Maryland Insurance Administration, we usually say Medicare supplement. The federal government seems to prefer Medigap, same product. Do the Medicare supplement plans cover prescription drugs? They do not. There's some older grandfathered plans that do, but they don't cover prescription drugs today. What we regulate, so the Maryland Insurance Administration fully regulates the Medicare supplement product, which means that we approve the policy itself. The rates that are charged for the Medicare supplement have already been approved in our office. You can file complaints with us. With the Medicare Advantage and the Part D plans, we don't have full jurisdiction to regulate them. We make sure that the companies have the money to pay the claims to operate. And if you want to file a complaint against the person who sold you the product, you can file that complaint with us. But we do not have full jurisdiction over the Medicare Advantage and the Part D plans. If you have an issue with the Medicare Advantage or Part D plan, you can come to us and we will send you to the right place, which would be Health and Human Services. This is just some more information about, we enforce the insurance article of the Maryland Code and associated regulations, and this is where you can find that information. So this is, can the MIA help if I have questions about Medicare besides the Medicare supplement? So because the Medicare supplement is the only thing that we fully regulate, for the most part, if you don't get me, then the answer is they're going to send you to Medicare or SHIP. I mean, SHIP is a great entity. They can answer all of your Medicare related questions. However, you know, tonight I'm talking to you about all the different parts of Medicare, so feel free to ask questions about all of it. And if it's something I don't know, then I will also send you to SHIP. All right, so more Medicare supplement overview. The plans are standardized. They are identified by a letter. A, B, C, D, F, G, K, L, M, and N are currently sold in Maryland. An A is an A is an A, a B is a B is a B. They're standardized products. All you're doing is buying them from different companies, and you know, you're trying to find the best price. But the actual product is the same regardless of which company you purchase it from. It's important to remember that and this is unfortunately confusing. The Medicare supplements have plans A, B, C, and D. As you can see, they have A, B, C, D, F, G, K, L, M, and N. But then there's also Medicare A, B, C, and D, which is totally different. So that's just confusing, and it's just something that I note because, you know, it always comes up in presentations. So I finally just wrote it into the presentation to say, hey, just understand that maybe it's better, but this is what we're working with. All plans offer the same basic benefits, and the companies don't have to sell all plans. So if we approve a company to sell the Medicare supplement products in Maryland, they don't have to sell all the plans. They could just sell a couple of them. There are some older plans, E, H, I, and J. They exist. They're no longer sold. Those who are enrolled in the plans can keep the plans. C and F are available to purchase only to those eligible for Medicare before January 1st, 2020. So if you became eligible for Medicare January 1st, 2020 or later, you cannot purchase C and F. And that's because on that day, a federal law went into effect that said for new Medicare Part B beneficiaries, they cannot purchase a Medicare Supplement plan that covers the Part B deductible. So that's the federal government passing the Part B deductible essentially onto the Medicare beneficiary and saying that the products that you purchase, if you became eligible after January 1st, 2020, are no longer going to cover that Part B deductible. So C and F cover the Part B deductible, and so that makes them not eligible for purchase for those eligible for Medicare after January 1st, 2020. Now, if you became eligible for Medicare Part B before January 1st, 2020, and you just didn't take it because you were working and now you're thinking about retiring, then you're still eligible to purchase C and F because you were actually eligible before the date. Whether or not you signed up, that's okay. You're still eligible. You can still purchase it if it makes sense for you. So this bulletin that says only the policy cost will vary between companies, that is true. And you know, you do need to make sure that you understand how the different policies are written. And when I share the website, I will share that information with you as well. But I mean, it is true that only the policy costs vary between companies. This is a standardized, this is a little chart of the plans. And there's just like maybe two things I want to point out to you. First of all, if you look at the Part B deductible, which is 1, 2, 3, 4, 5, 6, 7 down, Part B deductible, you'll see that, like I said, only C and F cover the Part B deductible. Now the other plans do not. Part B excess charges. A provider who accepts Medicare can either accept assignment or not accept assignment. Accepting assignment means essentially that you're accepting what Medicare pays for that procedure, for that appointment, and you're not charging the beneficiary more. But if you do not take assignment, you can charge up to 15% more, and those are excess charges. And in those cases, only Medicare Supplement plans F and G cover the excess charges. And so if you're somebody who knows that you're going to be seeing providers that do not take assignment, you might want to consider looking at F or G. And if you just want to cover your bases because you just don't know, then you might want to consider looking at F and G as well. Plans F and G do include a high deductible option. So for 2023, that high deductible is $2,700. So that's what you're going to have to meet before the plan starts to kick in and pay their part. And I mean, for some people, it might be a great deal because those premiums for plans F and G high deductible are pretty low. I mean, they're certainly in most cases less than $100 a month. Plan N will require a $20 copayment for office visits and a $50 copayment for emergency room visits. And it doesn't look like I have any questions so far, but I do want to encourage you to ask questions if you have any. Check the time. Time flies. All right, so we have a rate guide that we publish. The Maryland Insurance Administration publishes a rate guide. It's pretty useful. That said, I'm not going to be disparaging toward Medicare.gov because that is also very useful. You can also find the rates for the Medicare supplement policies on Medicare.gov, and I'll show you both. So we publish this rate guide every January and July. It shows the most updated rates for all the companies that are offering the Medicare supplement in Maryland. We do have a note here that says individuals should contact the insurance company to learn the rates in effect when you're applying. Well, you're going to do that anyway as you're applying. But that's just because when we publish this, we it's a snapshot. So the one that gets pushed out on January 1st, it's usually a snapshot of their rates like one day in like late November, right? And these companies can come to us all year round and ask for a rate increase. So they can come in December, January, February. They get one per year, but it can be whenever, you know. So we could publish their rates in November, and they could have already had a rate increase by January 1st. So that's just a thing, you know, this is a snapshot twice a year of one day and the rates. There are discounts available. A lot of times, if there's multiple people in the same household with the same Medicare supplement policy, there's pretty reasonable discounts for that. If you move out of Maryland, you can usually keep your plan and your rate. That is very different than the Medicare Advantage plans, because with the Medicare Advantage plans, you are limited to the territory that they're selling in. And that territory could be pretty small, right? Like in the DC area, it could be just Prince George's County and Montgomery County. And if you move out of either two of those counties, then you have to choose a different Medicare Advantage plan. Most of the time with the Medicare supplement plans, you can move them if you move out of state completely. I mean, you can certainly keep them anywhere in Maryland, you know, but if you move to PA or you move to Florida, et cetera, you can usually keep your plan. However, call the company and make sure, because there isn't any rule that says that they have to keep your rate. So in some cases, they might rate you based on your new zip code. If they do rate you on your new zip code, that might be less, that might be more. There are 3 states that do not follow the standard Medicare supplement plans: Massachusetts, Minnesota, and Wisconsin. So if you move to either one of those 3 states, you do kind of have to start over. I've contacted all 3 states' insurance commissions to make sure that you get a guarantee issue period, and you do. In each state, you get 63 days where you can choose a new policy without underwriting. So probably doesn't apply to most people, but if you are planning to move north, that's how that works. This is the inside of the Medicare supplement rate guide. It's, you know, it's a little bit different than the way Medicare.gov does it. As the insurance regulator, we don't ever want to look like we're promoting one insurance company over the other. And so this doesn't have any, it's a real page, but it doesn't have the insurance information on it. So it shows you that with the under 65s, this particular company is only offering Plan A to those under 65, but it's offering A, B, F, G, high G, and N to the others. And we do 65, 70, 75, 80, 85. That's obviously there's a premium for each age. And then the preferred rates are the best rates. So those are usually the rates that you will get if you're in good health for your age, or you're in a guarantee issue period where they have to give you the best price. This came up. I already said this. How often can Medicare supplement rates be increased? Once per year, but at any point, it's a rolling situation. So one company can ask for a rate. If they want a rate increase, they could ask for it in January, another in December. Is vision and dental care available under a Medicare supplement plan? No. It's important to note, with the Advantage plans, they have the bells and whistles. The Medicare supplement plan is only paying what A and B isn't paying. So if A and B doesn't cover it, and A and B does not cover vision, dental, hearing aids, or eyeglasses, that means the Medicare supplement plans are not covering it. There may be some exceptions to that, but that is, as a general rule, that is how they operate. If you have health problems, your Medicare supplement plan cannot drop you. Just FYI, it's considered guaranteed renewable. So this means your insurance carrier cannot cancel your policy unless you fail to pay your premiums on time, or you make a material misrepresentation, which is like, you know, our speak for lied on your application. If you're interested in purchasing a Medicare supplement policy, but you want to know about complaints against the insurance companies, obviously we get them, but you will find them on the National Association of Insurance Commissioners website. So that's where we send our complaints to, and you can get the complaints from all 54 states and territories by following this link. And we talked about this also. Can I keep my current MedSup policy or switch to a different one if I move out of Maryland? In general, yes. If you move to those 3 northern states, no. But for the most part, you can. With the Medicare supplement plans, there is no financial assistance available. With regards to financial assistance, the Quimby-Slimby program helps out with the costs of Medicare Part B and the additional costs that would be covered under a MedSup or a Medicare Advantage plan. And then with D, there is the Extra Help program through the federal government that can help lower income people qualify for assistance. There is also something called the SPDAP, Senior Prescription Drug Assistance Program, SPDAP. That program helps moderate income Marylanders with help with their Part D premiums. So if you consider yourself moderate income, and I think the last time I saw the program, they considered an individual with up to $50,000 a year income to be moderate. So I mean, that's pretty generous compared to most financial assistance programs. I would definitely look into it. So it's SD, I have a chat I can put this in. Senior Drug Assistance. I'll put it in the chat. I'm sorry. I just want you to be able to look for this program because it is super helpful and it will help you pay for your Part D premiums. Or, if you're here as a caregiver, et cetera, help you pay for your loved ones' Part D premiums. The last frequently asked question, I currently have a MedSup policy, but recently qualified for Medicaid. There are situations in which people can temporarily qualify for Medicaid. And in that case, they can suspend their Medicare policy for up to 2 years. So if that happens, hey, if you're going to be if you qualify for Medicare, Medicaid, that means you're not going to be paying anything out of pocket. You might as well take advantage of it. But if there's a reason that you're only qualified for a year or 2 years, you can suspend the Medicare supplement policy, and then you can go back to it. To reinstate the policy, you have to notify the carrier within 90 days of the date that you became ineligible for Medicaid. All right, these are just some additional resources. SHIP, they operate in every county in Maryland and Baltimore City. They are specifically trained to help you answer your Medicare related questions. I mean, we at the Maryland Insurance Administration, I work pretty closely with the SHIP program. I can answer your questions beyond the Medicare supplement itself, but for the most part, because that is the only product that we fully regulate, we kind of stick to that is the only product that we answer questions about. The Medicare Rights Center information is there. If you want to do some research, if you have a question, it can be faster than calling 1-800-Medicare. The one thing that I think about 1-800-Medicare is, I think I have the book behind me, and I think you probably all know it. This like Medicare and You book. This is what they answer, right? If it's in here, they'll answer it. You can also probably find it in here. But if you want more information than that, I really do recommend checking out the Medicare Rights Center website or the Center for Medicare Advocacy. Both of them are great resources that I use to get my questions answered about Medicare. And I'm going to stop showing these slides, and I'm going to share the Medicare webpage with you. All right. So you should see the Medicare webpage, and you may or may not be familiar with it, but I just want to, in case you're not, I just want to show you where you can find the information. All right, so Medicare.gov, if you are shopping for a Medicare Advantage plan, this is where you're going to find all your information. You're going to find it under Find Health and Drug Plans. And you are going to put in your zip code. I'm going to use the office zip code. And then that's Medicare Advantage Plan Part C. It's going to ask you about additional help that you might receive. If it's Medicaid, if you're receiving Medicaid, you may not need a Medicare Advantage plan. They're asking you, are you receiving SSI, the Medicare Savings Program, extra help? And this is just for them to calculate your potential costs and just make sure that you're on the right path. So I'm going to say I don't get any help from any of these programs. And I think I'm also going to say I don't want to see my drug costs because that would require inputting drug information. So this will show me, so my office is in downtown Baltimore, and it'll show me what Advantage plans are available to me if I was living in downtown Baltimore. And in this case, there's 15 plans. The first one that shows up is the Kaiser Permanente plan that shows that it's but you do have to pay the $164.90 standard Part B premium. And if you start to look into more of it, it shows you your deductible. It shows you the maximum in-network that you could pay in a year. So $6,900 being the most that you could expect out of pocket. It shows that your primary doctor is $10, specialist is $35. And this plan actually does not include drug coverage. So this is where you go and you can scroll down and you can look at all the different plans that are available. I want to go back and also show you the Medicare supplements. So Medigap, so they're calling him Medigap here instead of Medicare Supplement. All right, so in this case, if you wanted to purchase the Medicare Supplement, you could use the guide the Maryland Insurance Administration publishes. I like it. This one's actually pretty cool too, though. And I was playing around with this before the presentation started. So I put in age 70, I put in sex female, and I put I do not use tobacco. And now we're going to update those prices. So it tells me that there's 12 Medigap plans offered in your state, which you guys already know. And then it shows you the ranges for A, B, C, D, etc. So if I was narrowing in on like a G, let's say I was narrowing in on the Plan G high deductible, I could go ahead and look at the plan details. And then this, no, this is not where I wanted to go, sorry. This is the plan details, view policies. It'll show me the different companies. So it's telling me that Philadelphia American Life Insurance Company, for me, and putting in that information, I'm going to get the lowest monthly cost because it's going to show the lowest cost first. So this $39, this is the least expensive cost. And it scrolls down and shows you the other ones. So 39, 45, 48. And etc. Let's see, what does it go up to? All right, 101. So there's one more thing I want to tell you about. With these companies, let me just make sure I've looked at all of them. Attained age. Okay, they're all attained age. So there are 3 different ways that the Medicare Supplement companies can write their policies: attained age, issue age, and community rated. These are all attained age. So this really is an apples to apples comparison. Every single one of these is attained age. Most of the companies use attained age pricing. What that means is that you're going to see a bump in premium increase every year as you attain a new age. So you're pretty much kind of guaranteed to have at least a small rate increase every year. If you purchase a policy that is issue age, it's going to look more expensive starting out, but you're not going to see that bump in price every year as you age. So issue age is going to rate you on the age in which you actually purchased the product. So if you were purchasing it at 65, that is not to say that you will not see rate increases, because the cost of healthcare increase, et cetera, inflation, et cetera, you're still going to see rate increases. But with issue age Medicare supplement products, you're not going to see the rates, the bumps in premium that you see are going to be smaller, and they're going to be less frequent. Or, you know, they should be smaller and they should be less frequent. And it's complicated, I know. It's a complicated variable to like throw into this purchasing situation, and I understand that. It does make it easier when you're purchasing one where everything is attained age, because that is a true apples to apples comparison. I'm going to go back and just look at, I'm going to look at just like the regular G plan and see if we can see more than just attained age. I think that'll be useful. Okay, let's see what Plan G shows us. Sorry, I hope I'm not making anybody dizzy. Trying to get through it as fast as I can. Okay, here we go. I have another one. So most of these are attained age, issue age. Okay, I just saw one that was issue age. There it is. Okay, so it's not surprising that it's, you know, further down they've issue age, right? It's likely to be more expensive and less rate increases. So it would kind of be, you know, further down. However, there's also a different rating. There's another one that's issue age. There's a different rating that's called community rating. And that, as far as I understand, is only AARP United Healthcare does the community pricing in Maryland. It's not to say that another company couldn't do it, but I've never seen another company do it. It's just United Healthcare. And that means that they're not actually looking at anyone's age. It's a pool, and essentially everyone's paying the same premium. A lot of people like that. They feel a lot more comfortable with the community rating. But I'm not going to tell you that one is better than the other. I just want you to at least have a basic understanding of the difference between them. So with that, I have 9 minutes left. So I'm going to stop talking and just ask if anyone has any questions.
I don't see any questions on my end.
Okay. Well, in that case, oh, I see the chat finally. Okay, got it. I'm going to put my email in the chat. There it is. All right, if you have questions, I'm putting my email in. Don't hesitate to email me. And if you're interested in checking out the Senior Prescription Drug Assistance Program, it's espidap.org. So with that, I guess I'll say good night, everyone.